Hello, everyone, and welcome back to our podcast, Let's Talk Health. I'm Dr. Benheim Albert. I'm a family physician here in Montreal.
Dr. Asayag, family physician at Physimed.
And Dr. Jan Azule, also a doctor at Physimed.
So welcome again to this podcast, and today we're addressing a very, very important topic about heart disease, coronary artery disease. Some people talk about heart attacks and whatnot. So this is what we're going to talk about, a very important subject. In the previous podcast, we talked about other issues, diabetes, cholesterol, whatnot. But heart attacks or coronary artery disease is a very, very prevalent problem on the planet, one of the leading cause of deaths. And it can be prevented and it can be dealt with. And you need to know more about it. And this is what we're going to talk about today. And hopefully you'll learn something about it in order to maybe change certain things that you do at home or in your life. So why is it often diagnosed late?
Yeah, the issue with heart issues is that it's generally something that's very silent, that it's a very slow build and progressive build over time that makes it that patients don't really realize there's a problem until often it's too late.
The other thing is that often symptoms will be atypical. A lot of people will not present with your typical chest pain. You know, you could have shortness of breath, you can feel tired. Especially women have often symptoms that are not as specific, and so it can easily be dismissed when these symptoms are really early signs of heart disease.
So again, it's another silent disease that creeps up. And as you've heard probably in our previous podcasts, there are many other diseases are silently creeping up on us, right? Like high blood pressure, a lot of times silent, even diabetes. People don't know about it until it gets manifested with all kinds of symptoms. So heart disease is about the same thing. It creeps up, it creeps up slowly on us. And but for the audience here, maybe we can talk about what is it? When we talk about coronary artery disease, what are we talking about?
So coronary disease is basically a buildup of plaque in the arteries that feed the heart. We know that the heart is a muscle, right? And you need that muscle to pump the blood. Well, that muscle itself gets blood from the coronary arteries to be able to function. And over time, these blood vessels will block with a buildup of plaque, and that will obstruct the blood flow and prevent basically the heart from getting enough blood and from functioning normally.
So it's a circulatory problems and builds up with time. And the heart is a pumping. Let's define that. It's a pump. Needs to beat all the time. Doesn't take any break. It goes on for our life, and it needs to be fed, like you said. And these arteries are really feeding the muscle of the heart. So if you work hard, let's say when you exercise or whatnot, the muscle of the heart needs more oxygen, and this is where the coronary arteries feed it. Now, there are many misconceptions about this disease. Any misconceptions you want to talk about?
Yes, most commonly people think that it happens more often in older people or in older patients, which unfortunately is not the case. And like we've discussed also with the metabolic problems like diabetes and cholesterol, that it's happening earlier and earlier in our patients. And that unfortunately we see that there are some patients that can be even as young as their 30s and have heart problems or have coronary artery disease that puts them at risk of a heart attack in the pretty short, immediate term risk.
Before you say something, I want to give an example here of a patient of mine exactly on this. 37-year-old who came to see me after an event. He was 37. You know, at this age, you think you're invincible, right? You think, heart attacks will happen maybe later on or never. But this 37-year-old was leading a little bit of a deviant lifestyle. He was overweight, I should say, even obese, drinking alcohol, quite a bit of alcohol, poor eating habits. And he had no idea that he was diabetic, that he had high blood pressure, cholesterol. He just pushed the envelope and boom, it hit him. And that really startled him for quite a few years. It affected him even mentally because, from being on top of the world to being so vulnerable, it affects you. So, moral of the story, it was a big shock. And now he is trying to revert all these deviant lifestyle in order to lead a more healthy life and to prevent further damages. So it's not just a disease that you find in elderly patients.
And what's interesting is he was 37, but that means it had started years before, probably even 10 years before, when in his 20s, maybe even earlier. And a lot of people, again, as I said before, a lot of people will think, well, I have no chest pain, so I'm fine.
Yeah.
That's a good example of a case where the problem was already starting way before his event, way before his heart attack.
Sure.
So, like you said, damages happen before, and the heart attack is really the peak of this damage where the patients become severely symptomatic. And what is a heart attack? Just for the audience to understand, the heart attack means that there is part of your muscle of the heart that dies. So the blood supply to a part of the muscle of the heart dies, and therefore the pump is not working as efficiently. If the heart attack is massive, too much of the wall dies, and then the pump fails. When it fails, well, you're done. So, you got to be careful with these things, and you have to be smart. And the key thing is to understand that this creeps up. And it's not because you're not symptomatic that it's not creeping up on you. So when our patient come to see us for medical checkups and all that, we find risk factors that can lead to that. Can you talk about these risk factors?
Yeah, definitely. So it is probably one of the most important things that we're going to check in these checkups, or at least in the blood test that we're going to do, is looking at somebody's cholesterol level, looking at their blood pressure, making sure that their sugar levels, or making sure that there's no diabetes that's there. Those are the main risk factors that we see. But then there is obesity, or just their weight in itself will be a risk factor and will be cumulative to these other issues that we're checking. Family history is a very important one as well.
Yeah. So genetics is a huge one.
Lifestyle, smoking, alcohol, huge also. Sleep apnea is also a big one that we often forget about. It's a real stress on the heart. So there's a lot.
Absolutely. But that's what we do when we do checkups for our patients. We go over all these risk factors and we point them to our patients and we say, look, you may not have any chest pain, but hey, let's not wait for chest pain to happen before you start acting on these risk factors. So genetics is huge. If you have a genetic predisposition, you got to be very aware of all those risk factors because, as we know, the apple doesn't fall too far from the tree. So if you have genetic factors, be mindful of these risk factors. And we named quite a few of them. So this is what we do. And our goal when patients come to see us for medical checkup is to identify them and to do something about them. A lot of times we see the weight issues, like you mentioned it. And nowadays, we have ways to help patients lose weight. So we tell our patients, either you do it on your own. If you have trouble, we can help you. There are now medications like Ozempic, Mounjaro, whatnot. These are the GLP-1s that we talk about that are super effective. Can you give us a little blurb on these meds and how you use them for these type of patients?
Sure. So these medications now that have become increasingly more popular, the idea is that it really helps control your appetite and your satiety levels to help you be in a or at least lower your calorie intake. These medications in combination, and this is really the crux of what we're trying to do in the weight loss program, is in combination with regular physical activity, making sure that you're doing the right exercises, making sure that you are changing your diet to have a more balanced approach. Altogether will allow you, or we see patients losing a significant amount of weight. And if, again, they're losing the right type of weight and making sure that they're not losing muscle at the same time, these patients will be reducing their risk factors quite significantly, specifically for heart disease and for cardiovascular disease.
It's also very important what you said when you said the right weight. What we're trying to reduce is body fat, and in particular, not just body fat, but what we call visceral fat. It's a popular concept, and people are hearing more and more about it. Visceral fat is basically the fat that accumulates around the abdomen, around the organs deep inside. And we know that visceral fat is a main driving factor for cardiovascular disease. So high visceral fat increases the risk of heart attacks and strokes and other things. So very important. It's not just losing weight, it's really losing fat, especially visceral fat.
So let's talk about now patients that are concerned about symptoms of coronary artery disease. Typically, what kind of symptoms do these patients have? And let's talk about the difference in men versus women. How do they present?
So like we said, it's very different for certain patients, right? Is that a lot of the times when this is actually building up progressively, it could be very silent and sometimes show no symptoms at all. Classically, what we'll see is a type of chest pain, feeling kind of like a squeezing chest pain, particularly if we're doing some form of physical activity or just putting some sort of physical effort. Sometimes it doesn't need to be anything strenuous. It could be going up the stairs. It could be getting in your car. And patients feel this kind of squeezing chest pain that lasts a few seconds and resolves, and usually resolves with rest. More classically, if you are having a heart attack, that pain can be a little bit more persistent, and some patients can describe this kind of numbing sensation, or the typical numbing sensation that be going up the arms or to the jaw. But the important thing is to know that it is usually more with effort, that not all chest pain is related to your heart. I don't want to say it's just bad. And that if you are seeing that there is some changes, particularly with effort, to go see your doctor and to come have a proper evaluation.
So this period of chest pain can happen, prior to an event,
Yes.
like a heart attack. We call it usually angina. And sometimes the pain can be quite squeezing pressure. It may, like you said, irradiate down your left arm, up to the jaw. Sometimes it doesn't have to. Sometimes you may feel it in the back. Sometimes you may feel it in your upper abdomen. And sometimes it presents differently for women, right? Women sometimes don't have the typical symptoms of angina.
In fact, it's well known that women and people with diabetes often are known to have less typical symptoms, let's say. As you said, upper abdominal. It can even feel like nausea or heartburn. We call it heartburn, but really it feels digestive. Shortness of breath is another one. Sometimes there's no pain. Sometimes it's really just feeling that, when I do an effort, when I walk a little faster, I get short of breath, and it feels a bit unusual. So shortness of breath is often one of these symptoms that's a little bit looked over, because it doesn't come with that typical chest pain.
So when the patients come to you guys with any kind of these symptoms that we talked about, what do we do for them? How do you investigate them? What do we do?
Yeah, so as mentioned with the blood test, what's really important is doing a full metabolic panel and making sure that we're ruling out a lot of these risk factors that are there. But there are some specific tests that we can do specifically for the heart to be able to better risk stratify our patients and understand what their true risk of heart disease is. More classically, or something that is generally a little bit more accessible, is something like a stress test, which is a ECG or an electrocardiogram that we would do on a treadmill, and this would show if the heart is having a hard time keeping up with the pump and with the activity that's there. So if there are some changes there, it could be a sign that that patient is at risk of heart disease and something needs to be done more immediately, or at least more investigations is necessary.
The way I often explain it to patients is that there's two steps, right? There's prevention, or trying to predict who's at risk so we can actually do something before. When someone has symptoms, when someone comes in with pain or shortness of breath or whatnot, then we're actually not trying to prevent anymore. We're trying to diagnose, right? Mm-hmm. We're trying to see if there's an actual blockage that we need to act on right now. And that's when the stress test is very, very useful, because as you said, you go on the treadmill, we stress the heart, and we see how it responds. And if there's a significant blockage, we will see it. The cardiologist is going to see it. So that's the go-to test when there are symptoms.
So we're pretty lucky at the office here. We do have direct access to cardiologists. We do electrocardiogram, we do stress test, we do echocardiograms. We do even cardiac scans, CT coronography. So we have all kinds of tests that we can do to explore, and understand why the patients come with certain symptoms. Not all symptoms, it's not because you have chest pain that automatically you have a heart condition. Many things can give you chest pain, but we, as physicians, this is our role to distinguish what is what. And now, when we diagnose the patients with angina, then what do we do? What's the next step? Patient has a coronary artery disease, been diagnosed, he has angina, or he may have had a heart attack. What's our approach?
Yeah, so it's definitely a more global or total approach on the patient. Again, it depends on if there is any specific factors that we need to treat, like the blood pressure. Again, usually if there's known heart disease right away, we do want to have a much stricter control of their cholesterol levels, a much stricter control of their diabetes and their blood pressure. But depending on the situation, depending on the severity of each patient, I think that's when it's very important to really make those major changes in your life to be able to prevent that from happening again. And a lot of the times it's some very big lifestyle changes, diet, exercise, and often weight loss that will make a big difference in the risk of it happening again or progressing from there.
The number one risk factor for a heart attack is having had one before, right?
Sure.
So people that have had a heart attack are at high risk of getting another one. So we want to do everything to prevent it. Sometimes it means medications. Often it means medication, a baby aspirin, cholesterol medication, and as you said, controlling all these risk factors. Sometimes it means also interventions like putting a stent, opening up that coronary artery that's 95% blocked. In some cases, when there's too many arteries that are blocked, there's a bypass. You need a surgery, which we call a coronary bypass. So these are things that we need to do, first of all, to address the very acute issue and also to prevent another episode in the future.
So basically, when patients have coronary artery disease, we have to determine as physicians whether we're going to be aggressive and treat with a procedure, being an operation like a bypass or a stent, or being able to control the heart condition with specific medications for the heart, and as well being able to control the risk factors either by medication or by lifestyle changes, right?
Or both.
So, or both, of course. So, I urge you, if you have any of those symptoms, or if you have a family history, or if you have any risk factors, I urge you to speak to your family physician about it. Don't wait until you have an event to react. You're going to be late in the game. Always better to be, ahead of the game. So heart conditions are serious conditions, but you have to understand they're silent. They creep up on you, and you got to be smart in how you approach it. Speak to your family physicians. Do prevention. Prevention is the key in my mind if you want to prevent an event or prevent the recurrence of an other event. So on that note, anything else you want to mention on heart conditions?
I will just summarize what you said. Don't wait for symptoms, but if you have symptoms, don't ignore them.
I think that, again,
Very
there's
important.
plenty of tests and plenty of things that we can do to really see what the real risk is and how to better approach it. So again, just to add to that, is important to really make sure that you are up to date with your checkups, with your tests, and not to ignore any symptoms or any family history that's there.
On that note, I wish you well, and thank you again for all the positive feedback you give us on the podcast. If this podcast, if you found it interesting, don't hesitate to share it with your friends, your family members, and we'll see you in a couple of weeks with other interesting topics.
Thank you.
Thank
Bye-bye.
you.